Okay, so we're going to do an intramuscular administration. So the first thing I'm going to do is gather my supplies. So I'm going to do hand hygiene, which I would do, but I'm a sweater during these videos. My body can't tell I'm doing a pass-out video or getting robbed. So I'm going to gather my supplies, do my hand hygiene. I personally like to put on PPE when I'm gathering supplies just because I'm a little bit of a germaphobe when I do things. So putting on my gloves. I'm going to do my first check, which is I'm going to check the MAR to see what kind of medication we're giving. Ketorolac, and that matches with this, Ketorolac. So it looks like we're supposed to give 15 milligrams, and with this vial, it's 30 milligrams per milliliter, so that comes down to a half a milliliter. So I'm going to get a 1 milliliter syringe with my needle. As I'm going to gather my supplies, this is going into the room with me. So is this. So first thing I'm going to do is I'm going to clean the top of my vial here. So I did my first of 3 checks and I confirmed that's what I'm giving them. Confirm that's what's on the medication bottle. So that's my 1 of 3 checks. Next thing I'm going to do is open this up. I want to use a 1 milliliter syringe. So that's the appropriate size. So clean off the top of that. Got that on there. I'm going to put that over there. Now I'm going to draw up. Maybe if this will work with me. I'm going to draw up half a milliliter of this solution. The top of this is dry, and I did clean it off. So what I should have done was get air in my syringe before I did it, but I did not. So now we're going to go back to 0.5 on there. That out. I'm going to do the one-handed scoop technique. Wish I wasn't so shaky for this. To recap this, if I had contaminated this needle, set it down on the table, anything like that, I'd get a different one and toss it away, but we didn't contaminate it or do anything like that, so we're okay. Now I would put this back, and I'm only going to draw this up for 1 patient at a time. So I'd put this back, I do my second check, Ketorolac, so this is going back. This is just an anti-inflammatory, so it doesn't have to be locked up. It's not an opioid, anything like that. Okay, now I'm going to switch my gloves out. Take those off for right now. Take my med cart into the patient's room. I would knock. Hello, my name is Caden. I'm a student RN. We're going to be doing an intramuscular administration. Looks like we have a little bit of pain going on for this. It's an anti-inflammatory. So before we give it, the thing I was going to let you know about, and I'll remind you again after we're done, is that this is an anti-inflammatory. It's a little bit stronger than ibuprofen, so we might have some abdominal cramping. There might be some pain at the injection site. You're gonna feel some pain when we do the needle part. We're just gonna be honest. I'm gonna close the door behind me now. I'm gonna do hand hygiene again. Can you give me 2 forms of identification? Can you tell me your name and birth date? So I'm gonna scan this, maybe. All right, so it's not going to scan, so I'm going to unplug this and try again. No such luck. Oh, did it do it that time? Nope, didn't do it. Okay, so it's not going to work. So I'm going to, can you see from that far? Enter this manually on your wristband here. So in a perfect world, they would have told me their name, and I would have scanned this, and it would have worked. 1359 648. Okay, patient verified, so that worked. You told me your name. It's Smith Jane. Jane Smith. Jane, do you have any allergies that I should know about? No allergies? Perfect. And then I was checking your chart, and earlier it said that you had some pain, 5 to 10 on the left side of your chest from coughing. Is that still going on? Okay, it is still going on. I have to do this intramuscularly, so I want to make sure that it's in a comfortable spot for you. Is it okay if we do it in the arm? Because that's preferred spot. It is okay, perfect. Do you have any history with ketorolac? I know that I asked you about your allergies, but just to double check if you've taken this before. It's okay, so you have, so you know what to look out for. As I mentioned before, I'm gonna have some GI pain. I'm gonna do hand hygiene again, and then I'm gonna put my gloves on. So we discussed pain, discussed all that. Looks like your vitals beforehand were pretty good. We're definitely gonna keep an eye on that just to make sure that we don't have any major reactions when we go on here. So, like I said, we are gonna do this intramuscularly. And I learned this from the doctor's office clinical I did yesterday. I'm gonna put this right here and have that ready. Okay, so I'm just gonna raise your bed up so it's comfortable working height for me. And then if you're okay with it, I know you got a little bit of chest pain. I'm gonna put you in an upright position so you're comfortable too. I wanna minimize any pain that you're gonna have in that injection site. We want you to keep your arm relaxed. And that'll just kind of help you from getting pain. I don't know why I couldn't think of the word. Okay, so we're gonna do it in this side here. If that's okay with you, if that's tolerable. So I'm gonna take my alcohol prep pad. We're gonna get here. I don't want my computer to go down on me. I'm gonna wipe your arm here. And while I do that, before I get ahead of myself, because I got a little bit frazzled with that computer scanner not working, I would do the 6 rights for medication. So I have the right patient. I verified my right dose, which is 15 milligrams, which is half a milliliter. So right patient, right dose, right medication, right route, right time. Looks like it is time for it. We have about a half hour to do it. And then right reason and documentation. So I checked all of that. I drew this up for one patient at a time. So I know that this is still here. I know that this is still Jane's medication. So my third check is just, again, I'm gonna check ketorolac. That's what I drew up. Third check, this is Jane. It says on her hospital headband here, and she told me. I scrubbed this, made sure that we let that dry, went over my 6 rights and all that. So we're gonna feel a little bit of a pinch. I'm gonna go in at a 90-degree angle, and we have half a milliliter here. So usually it's about 10 seconds per milliliter, so this is gonna take about 5 seconds to administer. So now that I'm ready to put it in there, I'm going to take the cap off away from me like that. We're gonna go in at a 90-degree angle. Let me drop this down so it gives me a little bit more room. I do the Z-track method, but as you can see in the video, this is wibbly wobbly. So I'm just gonna pull that, act like we're doing the Z-track method, dislocate our shoulder while I do that, pull it that way, and we're gonna do it in a dart-like motion. So we're gonna go 1, 2, and 3. We got it in there. I'm gonna hold it like that. We're gonna do this for about 5 seconds. It's probably not gonna add up to be that time in the video. Like I said, about 10 seconds a milliliter. Done there. So now what we're gonna do is I'm gonna pull this out in the same way, 90 degrees, straight out. Engage this guard here, just like that. Put it in my sharps container, which is, thank you for getting that in the video. Sharps container here. Then we're gonna take this Band-Aid. Whoops. Don't mind that, that wouldn't happen in real life. Take this Band-Aid, we're gonna put it right over the injection site there. We're not gonna massage that in or anything like that. There is gonna be a little pain and tenderness there. And like I said before, we're just gonna have a little bit of, you might wanna watch out for abdominal cramping, abdominal pain. It's an anti-inflammatory, so hopefully that helps with some of the symptoms you have going on. Try to leave that injection site alone. If you can, use that arm a little bit to much of your ability. I'm gonna come back in about a half hour, and then we'll check on you and see how your vitals are doing, everything there. I'm gonna lower this bed back down to the lowest position. And then I'm just gonna go ahead and document that we gave you that medication there. All right, Jane, thank you.